I just want to say, first and foremost, this is a webinar being hosted by the State Innovation Exchange, and we're recording, so this can be shared with the broader legislative network. Please note that this recording will be available for your use as well, and you can return to it and to the amazing music you're hearing now and the brilliant comments that you're about to hear from our expert panelists. My name is Jessie Ulibarri. My pronouns are he, him, and as a two-spirit person, any pronoun said with respect is great for me. I'm coming from Osage and Shawnee land, just outside of Pittsburgh, Pennsylvania, although homeland for me is Colorado. As a former Colorado state senator, I'm so incredibly excited to be in this space with all of you to talk about the ways that we actually stand up and fight and put a little movement in our movement. The music you just heard is from one of our panelists, Dominique Morgan. And so, for me, it's really important. I'm rocking this shirt today. I'm not wearing my suit and blazer. It says ready to lead. This Pride Month, coming up to Juneteenth, thinking about the work that's happening around liberation, our communities need to stand up and fight. And that means leading in the ways that we know best from our lived experience. So we're going to hear from an amazing panel to really talk about what does it look like to lead from our full power, to lead from a place of joy and liberation, and do that in ways that are completely transformative. Again, if you're just joining us, please put your name, your pronouns, where you're calling in from, and the position you hold if you're a legislator or legislative staffer into the chat. We'll be using the chat function throughout the course of this webinar, so know that you can type in questions and we'll have folks help to moderate there. Again, I want to just make some quick housekeeping comments here. The State Innovation Exchange is a national resource and strategy center designed to support legislators who are working to move bold, transformative public policy. And we do that in partnership with movement peers across the country in every single state capital. For us, it's really important that this work happens from a movement-centered place and that we have the expertise of folks who are leading on the ground. So we're really excited for this panel today. I'm going to introduce our panelists, and then we're going to jump into some questions because we're here to talk about the wave of anti-transgender legislation that has been in state capitals across the country and what it looks like to stand up, to push back, and have a new vision of what's possible to affirm and support trans communities across the country. So I'm really excited to say that we have three amazing panelists, people I look up to, that are here with us today. Corinne Green is the Policy and Legislative Strategist at Equality Federation. In this role, she tracks all LGBTQ-related legislation across the country and provides policy analysis and support to Equality Federation members. Corinne is a harm reduction and queer rights activist from New Orleans, Louisiana. Prior to joining Equality Federation, she worked for Transgender Law Center, where she oversaw the passage and implementation of California's Gender Recognition Act, the country's largest expansion of access to non-binary gender markers, and created the Protect Trans Health campaign to defend gender identity protections in the Affordable Care Act. Dominique Morgan is our next panelist. She's an award-winning artist, activist, and TEDx speaker. As the executive director of Black and Pink, the largest prison abolitionist organization in the United States, she works to dismantle the systems that perpetuate violence on LGBTQ and gender nonconforming people and individuals living with HIV and AIDS. Partnering her lived experience of being impacted by mass incarceration, including 18 months in solitary confinement, with a decade of change-making artistry, advocacy, and background in public health, she continues to work in spaces of sex education, radical self-care, and transformative youth development with intentions of dismantling the prison industrial complex and its impact on our communities. Finally, our last panelist is Representative Brianna Titone, who was elected in 2018 as the first openly transgender legislator in the Colorado General Assembly. She serves as the vice chair of the Joint Technology Committee and serves on the Health and Insurance Committee and Energy and Environment Committees. Additionally, she serves as the chair of the House Democrats LGBTQ caucus and is dedicated to eliminating gaps in consumer protections, healthcare, and LGBTQ rights in Colorado. I will also say Brianna is really wonderful at puns and limericks, so I've seen her just on the floor. I wanted to make a few accessibility notes too before we begin with questions. We are using the closed caption feature. You can click at the bottom of the screen to have closed captioning available during the course of this. And if there are any specific technical issues, please chat in and the staff will help to navigate that for you. So we're going to jump right in. Corinne, you've been keeping a close watch on the onslaught of the coordinated anti-trans legislation that has been introduced this session, as well as the proactive, innovative policies being introduced. Could you give us an overview of what's been going on across the country?
Yeah, absolutely. So I think, as most folks have recognized, the largest attacks have come in the form of medical care bans and athlete bans. And we've seen our opponents really hone in on trans youth as kind of the most vulnerable segment of our population. As their kind of broader attacks on the LGBT community have started to find less and less purchase in state houses around the country, they've really found that taking advantage of people's kind of lack of education around trans people and kind of wiring to care about the children has worked really well for them. So just very briefly, I want to share some quick graphs with the screen share for folks to see how these numbers have gotten so much worse in the last several years. And so I think this should work. So if folks can see this, just nod if that's working. All right, cool. So as you can see, the number of specifically anti-trans bills has just grown more than double what we were seeing, just 5 years ago. And then I have one more slide that shows the breakdown of those. So of the anti-trans bills, this is what it looks like in terms of healthcare bans and athlete bans. So these are really where they're putting a lot of their energy. And so what these are designed to do, if you were lucky enough not to have one in your state this year, seek to basically ban transgender kids, specifically transgender women, from participating in school sports. And then also make it very, very difficult for transgender children to access gender-affirming care. And specifically around the healthcare bans, they started several years ago kind of very, very broad, prohibiting even talk therapy. And what we found is that they're really narrowing down. That was one easy way that we were fighting them, is saying how ridiculous it was that they couldn't even talk to a therapist about their gender identity. But they're really narrowing it down. So some are just surgery bans, and some are kind of broader exclusions around physical interventions like hormone replacement therapy, puberty suppressing drugs, those kinds of things. But these aren't, unfortunately, the only kinds of bills we're seeing. And there's a broad swath of attacks that we're seeing that aren't that don't fall into those two categories. So there are still efforts to prevent trans people from using the correct restrooms. One of the most egregious bills we saw this session in that area is the Tennessee bill requiring a very specific warning sign to be put up outside any bathroom that a trans person is allowed to use. It's supposed to be 6 inches by 8 inches, use scary red lettering, all this kind of stuff. It's in there. And so we've also seen attempts to increase penalties for trans people who are perceived to be in the wrong restroom. We've seen limits on people's ability to update their identity documents. We've seen limits around including trans healthcare in certain insurance plans in various states. Targeted attacks to exclude trans women from women's shelters when they're on the streets and need a place to stay. And so we're really seeing kind of a broad swath of attacks. And so while the money makers for our opposition tend to be the athlete bans and the medical care bans, it's kind of a broad, still a broad attack. And what we're finding also is that they're rolling our issues into kind of the intersectional issues that our community has always dealt with. So bills that attempt to limit teaching around racism in America often have a component as well, limiting teaching around gender identity and sexual identity. And so there's kind of this broad pushback that we all need to be responding to as kind of a coalition of marginalized people across the board.
Thanks for that overview, Corinne. Rep. Titone, you're one of 8 transgender legislators serving in state houses this year, a figure that was doubled by the 2020 elections. And as we heard Corinne just detail, we've seen such a horrific wave of anti-LGBT legislation and very specifically anti-trans legislation this year in state houses. Reflecting on this past session, what thoughts come to mind when your mere existence has been continuously called into question and legislated against?
Yeah, thanks for the question. Colorado wasn't immune from these bills. We had several of those bills last year. And then this year we actually didn't have any. I think maybe it was because there was a new minority leader who wanted to try to be a little bit more working across the aisle and not be so inflammatory. And that's a good thing. But that didn't stop a lot of other states from getting on board with all of these bills. And it's really disheartening, because I know that even though we don't have any bills like this in Colorado, it still affects the people in Colorado. A lot of the youth are scared, for their safety even here, even though we have protections here. So what I've been trying to do is reach out to other LGBT members of state legislatures and help them with writing op-eds in their states when they have these bills, to try to, tell the truth about these bills. It's not something that we should just worry about what our own state's doing. We should really work on being an ally to everyone else in other states, and reaching out to say what can we do? How can we help? How can we educate people? Because that's what it really comes down to, is educating people on these issues. Trans people are still a very small minority group. We're often misunderstood, and that's why visibility is important. And that's why I try to be on different panels and participate in interviews, show up to school groups, and really show myself in Colorado. And it's hard to get outside of Colorado, but I try to work what I can do in different places to try to be an ally in other places, because they don't have those voices a lot of times, and the policies that they have in those other states make it difficult for the voices who are trans in those states to speak out. And so they need other folks to really step up. And that's what we all have to do. We're a community. We're, just because we're compartmentalized by our states and our cities, we're one country, and we need to stick together and work together to fight these things, because this is nothing new. These attacks on trans people is just a trope of a different color, because they've focused on the gay community, they focused on the lesbian community over the last 40, 50 years, and now the trans community are the ones that they're picking on, because it's a political football. It gets them, they get on social media, they get on TV talking about it. It really riles people up. And we just have to make sure that we're working really hard to show everyone that, we trans people are just working hard like everybody else, trying to do our things and work as part of the community to see the community be a better place. And we're not a threat to anyone. We're a value to our communities, and we need to be treated that way.
Thanks, Dr. Tone. Hearing clearly that the battles are in state houses, and yet it's a national fight. And what we see and experience in one community impacts many others. And Dominique, that brings me to the question to you. You work with young people, specifically systems involve youth, on a daily basis. How do you see these anti-trans bills, state by state, but also nationally, harming young people?
Well, I am born and raised in Omaha, Nebraska, and it's very awkward for me to know how oppressive my state can be, and these laws to not have kind of been rooted here yet. Black and Pink is a national organization, and we are seeking to create this lived experience of like equity amongst everyone, this idea of liberation and access to liberation. How are we manifesting those opportunities for everyone? I think outside of these laws, there's a truth that we as adults oppress young people every day. We do, when I listen to abolitionists talk about divesting from every other system, we are not talking about how do we abolish systems that harm and oppress young people outside of a law being enacted, right? This law is, for me, these laws have been a manifestation of the way that we navigate the bodies of young people in sexual health, period, right? And I think if we had done a better job of creating stopgaps for that for young people, period, these sort of things would not be coming up. So I want to say that because I think it's interesting to see advocates really focus on this law around folks' ability to transition, be it medically or otherwise, and these other things, but we're not really discussing the fact that oppression is oppression. So these laws are not going to impact white trans kids the way that it's going to impact Black trans kids. Is not going to impact white trans kids who have health insurance that can go the city over or the state over to get what they want to have access to, compared to the Black trans child who's in foster care, or the Latinx trans child who's in a group home because their parent has been put into a detention facility under all of these other archaic laws that we have uplifted in our country. So not only are these laws like really harmful to the experience of young people, I believe it's a byproduct of the way that we navigate young people generally in our communities. And we can't lose that. You know, I came out when I was 14. I'll be 40 next year. So I remember the time, you know, maybe y'all remember like when it was like us getting married was like the biggest thing we ever wanted to have happen for us. Like that was the root of our liberation, right? And I bring that up because I feel like there are things that we discuss within the LGBTQ plus spectrum that like inherently leave young people out. And so if we did a better job of including young people in like our overall liberation as queer people, I think we will be better prepared to push back on these laws that we're seeing happening. The last thing I will say is that we cannot expect people to be their best selves if they don't have access to whatever they feel or deem is necessary to be their best self. So we also are going to see a domino effect of young people in our communities who are going to suffer, who are going to stumble, who are going to fall because they are not given access to what they deserve to have access to. So in 5 years, when young people's grades are failing and young people are not, and the graduation rates are dropping and all these other things that we see come up, please know that the ability to be seen as your best self is a huge component to that. And so I don't want us acting surprised when we're watching our babies struggle even more than they're struggling already.
Yeah, that's so incredibly powerful. The ability to be our best selves and to know that this is a continuation of other forms of oppression that are interrelated and interdependent. And we have to see the big picture. I really appreciate that framing. Corinne, the question we've heard from most legislators in conservative-dominated state houses is, how do we beat back anti-trans legislation being introduced? Could you tell us about some of the innovative and effective pro-trans rights legislation and advocacy you're seeing in conservative state houses?
Absolutely. So first of all, I think one of the most important markers we've seen for like a mark of a state that's able to defeat this legislation are states where trans people have been walking the halls of the Capitol, have been involved in the policymaking process, have been part of criminal justice reform coalitions, have always been there doing the work, building those relationships with legislators, with kind of allied issue groups. And in places like Louisiana and Texas that have a really strong trans presence at their capitals through the Trans Education Network of Texas and Louisiana Trans Advocates here in Louisiana, Texas actually was able to defeat all of its anti-trans bills this session. Obviously, there's going to be the threat of a special session and what's going to come there, but that's really due to the legwork that trans people have put in on the ground there and the space that they've claimed for themselves in the broader movement in that state. And so I think that's really important moving forwards is for groups and people in other states to really endeavor to bring trans people along, make sure that they're being provided opportunities to actually engage in this process. And we've even seen in states that have vetoed some of these athlete ban bills that the key ingredient there was just face-to-face connection with the governor and trans kids. So they could learn about these people and their lives and make it real for them and not just kind of words on a page that don't affect their daily life. And so to that end, I want to make sure we're not just focusing on kind of these really dire attacks, but also kind of highlighting the really strong work that's going into moving things forward in a lot of places. So even in deep red states. So like I mentioned, Texas was able to kill all of their anti-trans bills this session, actually all of their anti-LGBTQ bills this session. Even if we are facing the threat of a special, but they're also innovating. There was a bill in Texas this year to train poll workers on respecting trans people and letting them know that trans people are one instance where there may be a mismatch between what they're perceiving in front of them and the ID that they're presenting to vote. And so even in states like Texas, there's innovation happening here. There is a bill in Hawaii that's making sure that non-gestational partners in many trans and even gay relationships, it's a kind of a unique combination of making a child and making sure that trans people in those relationships and queer people in those relationships are able to get on the birth certificate of the child very easily is another policy we've seen being pushed forward. Some places are actually getting out ahead of medical bans and they're removing by law, trans exclusions from health insurance plans as it exists right now in this country because we don't provide people medical care on a national scale. It is piecemeal. And so states are moving to make sure that insurance plans in their state can't discriminate. And we've also seen really broad coalitional work in terms of connecting LGBT groups with women's groups and reproductive rights groups to make sure that efforts along that front are inclusive of trans people. So making sure that legislation isn't gendered and saying that these services can only be provided to women, making sure that it's talking about pregnant people and other people who bear children, making sure that they're included in fertility treatment services, things like that. And there's often even kind of some fun stuff happening. Like Rhode Island has a bill that would require the government to apologize to a trans person if they dead name them in a correspondence from the government. I don't think that's going to pass, but it's the kind of thing that people are working on that gets these conversations happening, that brings the education into the Capitol, into where policymakers are doing their work, and really facilitating those connections that we've seen are what makes a difference in terms of fighting this stuff back.
Thanks, Corinne. Those are really insightful lessons. And for the legislators and legislative staff listening in, really want to encourage you to think about the questions you'd like of our panelists at the end of their remarks. We'll be getting there relatively soon. But holding central, what power do legislators have in helping to shape the conditions for additional bolder advocacy and organizing? How might you think about deeper partnership with trans community organizations and trans-led advocacy in general to change the dynamics like we've seen in Texas and Louisiana? And also, what does it look like to build from a place of trust and reparation from communities that have historically faced insurmountable state violence? So thinking deeply about those questions, what questions do you have of our panelists? You can chat them into the chat box here. We'll be getting to a Q&A section at the end, but wanted to just get your thoughts going, especially as folks who hold a unique ability to convene, to uplift, to highlight, and to speak out because you are state legislators or working in the state legislature. Rep. Titone, so let's talk a little bit about this as a legislator yourself. What tools as a legislator have you used to combat anti-trans legislation, and what else might you need to be helpful on the ground? What recommendations would you offer to legislators fighting anti-trans legislation and who are leading proactive legislation in their states?
Yeah, and then anti-trans legislation happens all the time, and sometimes it's not blatant. Sometimes it is, kind of hidden. And Corinne mentioned, pregnant people and how that needs to be recognized more in a lot of the things. When I was on the floor we were debating bills on the floor of the House, and one of the bills was, it said right in the title, pregnant people. And one of my colleagues came up and said, well, that's not what I believe is correct. We're going to change that to biological women. And I was just about to leave the chamber to go talk to somebody else, and I heard that, and I was like, oh no, they did not just do that. and I walked down to the well to say to defend trans people, because that's what was happening, was they were trying to erase us. So I told them, I said, people can get pregnant. You need to understand that biological women are not the only people who can get pregnant. Trans men can also get pregnant. People with uteruses can get pregnant. And I said, we're not erasing trans people today. We're going to vote no on this amendment and make this go away. And the funny thing is that the legislator who ran this amendment was someone who I had lunch with, who I didn't expect this to come from. So what I need to do is, have more conversations with folks on the other side of the aisle. I need to really do a little more outreach and educate those folks about this. And, it may not stop some of this stuff from happening, but maybe it'll reduce these kinds of things from happening. That's a really important thing that I try to do is really put myself out there for my colleagues to understand who I am and why what they do and what they say down the well is hurtful to me. And I have to often defend myself. Not every legislature has a trans person or non-binary person there. So, we're relying on allies to stand up for us. And if someone's saying something, on the microphone in a public forum, and you're an ally of the LGBT community, especially the trans community, don't just let it happen. Speak up about it and defend us. And that's going to be really important for when we can't be there to defend ourselves in person. When it comes to just legislation in general, especially in committees, what I've found is really important to fighting back against this legislation are personal stories. And we have a lot of folks come down and talk about their kids who are trans. And just this last year, this round of horrible bills, I remember seeing a few clips online of there was a father who had a trans kid, and he was very upfront about it. He's like, I didn't understand this. I wasn't sure if I accepted it, but then when I realized, I love my kids so much and I want them to grow up, and his powerful words were, if it didn't move somebody, I don't know what does. But those kinds of personal stories, and coming from people who may be more conservative, saying like, I felt this way similarly to you, and now I feel differently because it's hit home for me. And that kind of empathy and really finding those people who can talk to those legislators who are making those decisions, who are going to be voting on these bills, that's super important to communicate that we're trans people and we're your constituents, and what these bills do is really damaging to people, and then really showing what that kind of damage can do. That's one of the most important things that I can do. And then of course, any kind of LGBT organizations who are in your states need to step up. And if you don't have really good ones, it's not unusual for people in other states to come and testify on bills in other states. It happens here in Colorado quite often. And if remote participation for bills continues to go on, I know a lot of states are doing that. That gives a lot more opportunities for people in other states to step up and actually participate in those testimonies. So those are opportunities that you shouldn't miss out on at this point, to load up on the empathy and the storytelling, which is super important to really driving home that the bills that they're trying to do are damaging to their constituents and the people that they represent.
Thanks, Rep. Titone. The power of storytelling, of building deep personal connection, and showing up. State legislatures can be very intimidating for folks who are new to advocacy, but knowing that legislators and legislative staff have real ability to make it a much more welcoming and accepting place. And that means actually deeply engaging with directly impacted folks to have a say in the response to and drafting of affirming legislation, and also having a hand in combating these attacks. Dominique, you talked about the ways that systems of oppression are interlocked and the disparate impacts, particularly for Black trans folks and kids specifically in this moment. Many of the trans rights organizations nationally are white-led. As a Black trans woman leading the largest prison abolitionist organization in the country, how do you hold the importance of visibility in this moment?
Well, I think it's past visibility. I think, listening to some of the feedback from the panel thus far, I think we need to uplift that if we are advocating for folks in the ways we have historically advocated for folks, based on the systems that have historically existed in our societies, white people, whether they are trans white people, whether they are gender nonconforming white people, whether they are gay or lesbian white people, will be positioned to advocate for those of us who are oppressed the most in the spectrum of our experience. And I think allyship, this space of co-conspiratorship, I have this idea about allyship that, LaCroix is allyship to me. It's there, there's a hint of it, but if I want a Sprite, I don't want a lime LaCroix. I want someone who's really in it with me, and you're in it with me because the heat that's hitting me is hitting you as well. Not that you're at the top of the mountain talking about, oh, I bet that heat is really terrible. Let me talk about how bad the heat is. And I think that is why we really struggle as a community to see the sort of shifts we deserve, right? When advocacy is your job, as a person who engaged in advocacy in a way that I would say was kind of secondary in a way, yeah, it may not be only 8 hours a day, but it's not your entire life. When you are advocating for issues that are actually impacting your everyday existence, you're pushing back against that 24/7. And I think that as a Black trans woman in this work, I really struggle with, who are we centering, and why are people so afraid to be decentered? Why are some of the most degreed, the most people with access not grasping the fact that just because you're decentered doesn't mean that you don't matter? And I think that's much of our barrier. And I think that applies to everything in this spectrum we're talking about, from young people to trans and queer folks to folks in this space of gender nonconformity, which, you know, I, as someone who navigates my trans experience on the binary parts of it, I look at my the systems that oppress me, but I also look at many of my siblings who are gender nonconforming, and there's so much gray area in the ways that people are trying to figure out how they love and respect them. I can't even imagine what that's like to go through just TSA. There was an incredible article that I retweeted yesterday about the oppression and harm and the way that going through TSA is like harmful to the mental health of trans and gender nonconforming people. And so like that's the thick of it in our work. But representation, I think, for me, is a title. I'm trying to make sure that there are more folks like me than not like me in the space. I'm trying to divest from tokenism feeling great for me. I'm the only Black trans person that's invited to something. Like, that doesn't move me. It doesn't make me feel excited for you to make it seem like I'm the only one who's out here, because you have Aria Saeed, you have Mariah Moore, you have Kayla, you have Jasmine Tasaki, you have, I can name a list of girls who are doing this work and whose voices should be amplified. In the space of folks being appointed to political positions, the Transgender District did a political panel about a week ago. And I'm really gagging at the fact that we're not seeing Black trans people, specifically Black trans women, in politically appointed positions to do what Representative Titone is able to do. When you hear something on the floor and you can walk right down and say, we're not doing that. Because it's cute to tell a girl to go up there and testify, but I've driven 3 hours to be heard for 2 minutes. I've went through the training to try to expose and show the world the deepest, darkest parts of how I've been harmed, to sit in front of 3 or 4 legislators in Nebraska and for them to act like I'm reading them my grocery list, right? I also don't want us to keep pushing people to position themselves to be exposed, to go through their trauma, to prove that they should be treated as human beings. And I don't think positions are the be all end all, but I think it's a step. If you were to look at the people who are in power in our community who are trans and queer, you would think that Black and brown trans people don't exist. You would think that our existence is predicated on prose and sex work. And for many of us, that is our truth, because that's just what it is. But we also have girls out here who are in tech. We also have, like, there's a spectrum of our experience, right? And I think that's what's really important. It's representation is kind of that picture, that name. We're talking about an amplification. We're talking about a centered experience for trans Black folks. And we're talking about challenging and calling in white trans and gender nonconforming folks to really get comfortable with being decentered, to be decentered with love, to say, I grew up with the old school mom and daddy. Now, I don't know how y'all did in y'all households, but if you sitting on the couch and there's one chair and an elder walks in, did y'all just sit there and look at that elder while they stood there? Or did you get up and give that chair up? You got up and gave them the chair. Get up, your auntie need to sit down. Get up, your grandmother is coming in the house. Because it was respect, because you understood that what that person had went through that day, your body hadn't went through the same thing, so they needed that seat. I need white folks who are within our queer community to have that sort of grace. And the last thing I will say, because I'm taking up space, but I'm not taking up as much space as I should based on some of the things that have been said, but I will say that a grace quotient is really important as well. We are not limitless people. We would like to be, but we are not. And so this idea of advocating, and sometimes we do need folks who are not the most oppressed to go out there and be at the front of it because they have a higher capacity to handle it. But that person also, again, needs to be really in tune with themselves to understand when is it time to get out of the way. That grace quotient allows us to understand ourselves. It allows us to recognize the power of community. And it allows us to say, like, I don't have to have everything, but I can just have the belief that you should have everything. And I may not be the person to give it to you. When we think about advocacy, when we're thinking about policy, when we're thinking about pushing in the ways that we know you have to around legalese and in the halls of injustice in our communities, that grace piece is really important.
Thanks, Dominique. Reflecting on your words, really thinking about centering and what it means to do that in a way that is the giving up of the chair, and to do it in a way where we're not getting the LaCroix lime, right? We're getting the full thing because we're co-conspirating together. Just some wonderful knowledge for the folks here on this call to hear and think about deeply about what it looks like to show up in full strength. And so that gets to the next question. This will be round robin and we'd love for each of you to answer. We know that the focus of this webinar has largely been on the defensive battles ahead, but we also need to celebrate the victories you've helped to achieve in your work. Each of you have been instrumental in the passage of proactive legislation centered on the lived experience of the trans and gender nonconforming communities. What does it look like or feel like to step into our full power to support and affirm the trans community? Whoever would like to go first, and then we'll just ask you to pass it to the next person. I don't think anyone wants to follow you, Dominique. It was a mic drop moment last, but keep going.
I will say that I think one of the largest achievements was, launching Light in House, because when we're looking at these policies, when we're looking at these systems, it's oftentimes really easy to forget, but also there's the day-to-day experience, right? Because even when a law passes, think about the First Step Act. We're years and years from that being passed, and we're not seeing the impact that we were promised. So how can we look at the future? I really feel like the work in policy and legal work is more of the vision statement, but we also need to address the harm that's happening in that moment. And so at Leiden, to create this space where folks can come and live and be nurtured on and loved is really important. And that's positioned us to purchase the land to build Opportunity Campus. It's going to be the largest space in the country centering the needs of LGBTQ+ youth who have been system impacted. Started right here in Omaha, Nebraska, a few blocks from the birthplace of Malcolm X in North Omaha specifically. And that's really important because I know that Representative Titone is in the halls of justice, talking about the legal work. Well, I need sis to know that I'm also out here in the streets. I want to do the work out here to match what you're doing there, right? That collaborative energy to creating solutions and change-making moments for us as a community. So those would be the ones that I think of the most, that I hope live long after I'm gone. And I will pass it to Representative Titone.
Well, thank you, Dominique. I appreciate all the words that you said so far. And, it's a really good reminder to understand we're not doing enough until everybody is lifted up. And as much as I try to do it in the Capitol and mention Black trans women, especially when I ran the Gay and Trans Panic Defense bill, it was Black trans women that I said on the microphone is why this bill is so important and why we need to do this now. And we passed it just before we broke for the pandemic because it was too important to kick the can down the road another year. But that's such an important thing is to work. I'm inside the building. There's a lot of people outside the building. You hit the nail on the head right there, is that we need to have more conversations with the groups on the ground, doing the work, experiencing all the things that they're experiencing and understanding it better. And I can't do my work as to the level that I need to without doing that. And it's really easy when you're a legislator to get distracted by all of the things that we do on a regular basis. And I mean, I carried 23 bills this year. And, for me, as a trans person in a conservative district, I don't do a lot of bills on LGBT issues because that's not what my district's asking me to do. But I need to step out and advocate more. And, there's a lot of other legislators who are on the call. It's not about just being an ally. An ally is standing there just listening and saying, yeah, kind of being a cheerleader. But it's about really standing there doing the work for someone who can't do it, so that way they can get the microphone. And we can all do that. And we can all do that more. And I encourage everybody who's on the call right now, who's a legislator, who doesn't have a trans person in their legislature, that they're going to need to do some work to get more people in the room. It's really, to me, I always like to mention Andrea Jenkins and Philippe Cunningham because they're not invited to a lot of things too, and they need to be known about who they are and how important their roles are in elected office, because there are so few Black trans people who are elected, and that definitely has to change. And I'm going to reach out to you later on, Dominique, to see what I can do to help you, because I have work to do for myself too. So we can all do some change, and working with people like you in those organizations is going to make a big difference.
I'll say that the policy that I've worked on that has meant the most to me is also the one that is furthest from being explicitly LGBTQ and trans. The first bill I ever wrote and passed, like all on my own, for Louisiana trans advocates. I was also involved with an underground needle exchange in New Orleans, and we were trying to start a program for like bars and convenience stores and gas stations to have naloxone behind the counter. Naloxone is an overdose reversal drug. If somebody is overdosing on opioids, you can give this to them and they wake up. And we ran up against the issue that nobody wanted to keep naloxone behind the counter because it was technically illegal to do so. And the rest of my scrappy anarchist friends figured, I guess we have to stop. Nobody's going to do this with us. And I said, well, actually, I think I have these skills from LTA and working on the slow march of moving our non-discrimination bill forward each year, that I think we can look up where this is in law and change it. And so we looked it up. It was just a 1-sentence fix to make it so that people could possess naloxone without prescription. And we wrote it and we ran it as Louisiana trans advocates. And I had people telling us not to do it, that's not a trans issue, but we ran it and we brought our folks along with us and explained, why these issues affect our community, because we're disproportionately using substances, we're disproportionately picked up and arrested and incarcerated for using substances. We're disproportionately, blocked out from the medical system for the treatment for using substances. And so getting this kind of direct support to folks on the ground was absolutely a queer issue for us. And just that process of working with people on the ground, identifying a need that was going to make a real difference, and then following it through in the legislature and bringing folks along for it, is the most important legislative accomplishment that I feel like I've committed or I've done, and it has really impacted and kind of guided my work going forward. And I encourage everyone, especially the legislators on here, to think expansively about what is a queer issue, what is a trans issue. Criminal justice reform is absolutely a queer and trans issue. And so when you're working on it, involve groups in your state who are queer and trans groups to make sure that they're asked about this stuff, because that's an opportunity for you to start putting language in to make sure that incarcerated folks have access to the right property and are gendered correctly. And if you can push far enough, are placed in the correct housing situations. And so think expansively about what counts as a queer issue. And so even if you're in a state where you worry that you can't pass a bill that says gender identity or sexual orientation in it, in all the other work that you're doing, make sure that you are involving queer and trans voices, especially Black queer and trans voices, and incorporating them into the process. That's super important.
Thanks, Corinne. We're going to do one more round robin, and then we're going to go to the questions from the audience. We are seeing and tracking the questions folks have already populated into the chat box. You can also ask an anonymous question using the Q&A function, and feel free to send those in. We'll try and get to as many as we can, but thank you again for having those in already, and we'll start with this question. And we're going to go in reverse order. So Corinne, then Rep. Titone, and then to Dominique. What would you like the state legislators and other decision makers on today's webinar to know about your vision for advancing trans rights? What kinds of progressive trans legislation would you like to see take hold across the country?
I think that the obvious answers are around access to identity documents and healthcare. I think that especially with the attacks on healthcare for trans kids, it's an important time to recognize that so many people in this country already just don't have access to healthcare, period. I know there was a Supreme Court ruling today that affects that in a not horrible way, which is good. But we're so far behind where we need to be just in terms of healthcare access for folks, and especially marginalized people. So as Dominique mentioned before, I think that's something to be very aware of moving forward. And then identity documents access is super crucial to trans folks. It's kind of an obvious place to go, but there are lots of tweaks that can be made, I think, even in rough states, to make things more accessible for folks. You can do work on the regulatory side if you're friendly with the administration to look at processes there. You can even do local work. In a lot of places, the fees and fines are different, not fines, the fees are different for name changes and getting a new license or something by county or parish. And so even you can just work with municipalities and counties to revisit those structures in ways that doesn't always require legislative intervention. And so I would just encourage the legislators and staff on here to think critically about being a leader in this area, and think proactively about ways to move things forward, even if you don't feel confident that you could get an explicitly supported bill through the floor.
Yeah, I would echo what Corinne said. We just passed a couple of years ago identity document changes for trans people, and that took us 4 years to accomplish. It was a tough fight to make, and I think Jessie, you were there when we were still doing that, and we finally did get that passed. And but healthcare, I would totally agree with healthcare. It's not just about access to healthcare, which needs to be fixed on its own, but also making sure that healthcare providers are trained to be able to talk with and effectively treat trans people. And I'm going to bring up that 60 Minutes report that they had on a few weeks ago, and one of their segments was about detransitioners and how their healthcare providers didn't, they just handed them over some hormones and gave them permission to go do surgery. And it's like, that shouldn't happen. The healthcare access and how people treat trans people should be with some actual training and how to actually treat trans people. And if there's not enough adequately trained people that are helping trans people in their transition, or people who think they're trans but may not be because they want to detransition later on, we want to make sure people are making the right decision. And that's an important aspect of what we need to do, is get people trained to actually treat people correctly. And when it comes to state legislatures, if you have a Medicaid program in your state that's expanded to people, that's a great place to reach a lot of trans people who need healthcare. In Colorado, we have one of the better treatments for trans people. We have a lot of inclusive things, gender affirming care that they can get. And that's a really easy way, because a lot of trans people are on Medicaid because they're underemployed or unemployed or worse than that. And we need to make sure that we're taking care of those folks who don't have access to those kinds of resources.
I hate to barge in, Rep. Titone, but I just want to make clear that it is much more likely that trans folks are going to encounter a barrier in accessing healthcare than they're going to be put on some kind of conveyor belt. So I just wanted to make that clear to folks listening, that is a a regrettable situation when it happens, but it's a very, very, very small number of people, and it is by far not the norm when trans folks have
Yeah,
access
that's
care.
exactly right.
Well, and I think, so before I was here at Black and Pink, I worked in adolescent sex education, and at a federally qualified health center here in Omaha, Nebraska. And it really impacted me recognizing that, again, we jump to a section of the health experience and we're not looking at a 360 perspective. Folks, especially Black and brown folks, trans folks, because also most trans white folks are not Caitlyn Jenner. They're not coined like that, right? Like, so, and when I say coined like that, I mean, historically, the more affluence you have, the better prepared you are or have been to navigate the healthcare system, period. That's from getting your COVID shot to going into the emergency room, right? We're not even talking about signing up for healthcare in a trans clinic, or if you're a person who's navigating the experience of living with HIV and AIDS in this community, so on and so forth, right? When you talk about the conversation of folks who have been incarcerated and impacted by the carceral system, the autonomy and the belief that you have the power to wield and navigate the system that it takes to really receive a quality health experience. Because be clear, the people who have the best experiences are the girls who will get on the phone and read the whole medical office down, honey. The girls who are getting their surge approved are the girls who have the wherewithal to call 6 times a day and can write the detailed and laid out email to their insurance folks and all the things. Not everyone has the capacity nor the experience to do so. And furthermore, I believe our current medical system is intentional about keeping that information from people. So I believe if we're offering access to comprehensive sex education, I think that's a huge missed opportunity with young people to begin to spark that space of, yo, this is your body, you own your body, and this is how you can make sure that your body is getting what it needs. 2, normalizing conversations around the needs of queer people, period, to where you have straight young folks who understand the power and priority of accessing trans affirming healthcare. Like, not just trans folks, everyone should have this information, because that's when you get cisgender straight parents who are informed in how to support their trans child. And then after that, we're talking about that space of storytelling, specifically with this question of many people are not supported in how they wield and own their story until you want to put them up in front of us mic to tell their story. If we are supporting folks in that autonomy of space of, this is who I am, this is what I need, this is what I've experienced, this is so on and so forth, and it's rooted in just them having that power, not rooted in us needing them for something, we're gonna see more folks that can combat these voices we hear. There's a reason that Candace Owens is echoes like that, because Black cisgender women are not promoted to spaces to where they're on a platform to where you're hearing 10 Black women who are talking about a complete experience of Blackness compared to Candace Owens talking about whatever space of Blackness she's coming from, right? Like, and so we have to even the playing field, and not necessarily to put them in positions to be like the talking heads for us, but just so that people have that power. So people, because that is a part of a story where these folks had access to care that was not good. That's the story. The story is that people didn't have quality health care. And so no one talked to them about what their needs were and the why of their experience and what was affirming outside of medical transition. So many people I know who have incredible, powerful, brilliant trans lives that never took a shot of tea or never took any estrogen, right? Marsha P. Johnson wasn't on Moans, and she's one of the most pivotal trans women to ever live, right? And so because they didn't have quality health care, their experience around trans healthcare was not quality. Not that these people were made to transition and that's not what they wanted, but because people aren't given access to storytelling tools and the autonomy to really live in our story and own our story. If you don't tell your story, somebody not only else will, they're going to tell you what your story is. And for the most oppressed people, that has consistently been our experience in this country.
Thank you, Dominique. And thank you all the panelists. Just reflecting back the depth of wisdom from each of you. that what the trans community is seeking is autonomy, agency, the right to joy, the right to community in a way that is possible, that we know is within our reach because it happens in the spaces with each other, the way that people hold each other's backs, and what it looks like then to change the systems to model what community really looks like. So thank you for those offerings. We have a few questions and only 3 minutes left, so I'm going to pick one or two, and then we're going to have to close. You'll see in the chat, we've just dropped in a survey. We would love to get your feedback on this panel and additional supports that SIX can provide to you as state legislators and state legislative staff to really think about the ways to step up in our leadership today. So there's a question that came in for you, Corinne, that I wanted to ask here. How does the Biden administration's extension of protections to transgender students affect the anti-trans legislative proposals we've seen this year?
Yeah, that's a really good question, and I think a lot of trans people are wondering that. The Biden administration has made several promising moves in this direction, and they've kind of hinted that, for example, states that have passed athlete bans should start having parents of children who are affected by that file official complaints with the federal government and their compliance side of Title IX enforcement. The hope, at least in the movement, is that the Biden administration will take legal steps against states that have passed some of these policies, and in reinforcing and reinstating the guidance that the Obama administration submitted around trans people's inclusion in schools, go further in actually implementing that in terms of seriously threatening to withhold funding from school systems that discriminate if they continue to push these things further. And so they haven't committed to doing anything like that yet. That's the hope. And then, of course, our argument has been consistent for years that trans people are covered by these laws that prohibit discrimination on the basis of sex. And so, we would say that things haven't changed. We're just having an administration recognize this. And so I would encourage folks, if you have a law like this in your state, to start directing people to the federal government to file complaints so that it gives them a foot in the door to take the next legal step if and when they're hopefully willing to.
Thank you, Corinne. We have 1 minute left, so I want to first ask each person who's participated and listened to our panelists today to drop in one thing that you're carrying forward from this conversation and what you want to carry forward into your work in state legislatures across the country. Again, you can just throw in your name and a key lesson that you heard. And also, if you'd like to shout out and love on our amazing panelists for their contributions today. We really appreciate each of you coming in to share your perspective, your lived experience, and your deep technical expertise to help us build the kind of country that each of us deserve, and specifically our trans brothers and sisters deserve, and non-binary siblings, all of our folks. So thank you all so much. Again, please drop in any comments that you'd like to leave here. We'll be following up with a survey about this, and then this recording will be made available publicly. So know that you can return to this and you'll have direct access to the panelists. Please follow them on Twitter. Please follow their online profiles and their amazing work, and stay connected. Thank you so much and have a great afternoon.